Imagine this. You are desperate to speak. You simply want to utter a complete sentence. I love you, or maybe just thank you. But every time you open your mouth, your chest tightens, your throat constricts, and the words get stuck there like a heavy boulder. You are a stutterer. How deep is that desperation? Is it deep enough for you to sit in a wooden chair, let strangers strap your arms and legs down, and allow a razor-sharp blade to slide deep into your mouth? No anesthesia, no painkillers, just you, the doctor, and a blind faith that says, to heal the voice, we must mutilate the very thing that creates it. What I'm about to tell you isn't a script from the movie Saw. It is historical fact. A medical craze that swept through Europe in 1841, where hundreds of people voluntarily walked into a slaughterhouse to trade their flesh for a voice. Welcome to the darkest chapter in the history of surgery, Dieffenbach's cut. To understand why this nightmare unfolded, we must turn back the clock to January 7th, 1841, Berlin, Germany. The man behind this velvet curtain is Johann Friedrich Dieffenbach. Make no mistake, he was not some back alley butcher. On the contrary, Dieffenbach was a shining star, one of the greatest pioneers of plastic surgery of his time. He was the man the aristocracy turned to when they needed a broken nose fixed or a cleft lip repaired. But even geniuses can make mistakes. And Dieffenbach's mistake stemmed from a deadly logic, analogical reasoning. At that time, medicine had just achieved a major breakthrough in curing strabismus, crossed eyes. Doctors discovered that by snipping the contracted eye muscles, they could allow the eye to return to a normal position. The surgery was a resounding success. Dieffenbach looked at that success and asked himself, if crossed eyes are caused by muscle spasms, then stuttering must certainly be caused by a spasm of the tongue. He hypothesized that stuttering was caused by a spasm of the glottis, a misguided nervous influence traveling to the tongue. His solution, simple, brutal, and very mechanical. Sever the nerves and muscle pathways at the root of the tongue. According to Dieffenbach, this would interrupt the so-called nervous current, causing the twitching, liberating the tongue from its chains. He called it the radical cure. But there is a small detail, a horrifying detail we often forget when looking at old medical paintings. The year is 1841. Remember that number, because the first public demonstration of surgery using ether anesthesia wouldn't happen until 1846. That is 5 years later. What does this mean? It means every patient walking into Dieffenbach's clinic was wide awake. They heard every sound, smelled every scent, and felt every fiber of muscle being separated in real time. Now take a deep breath. I'm going to take you inside that room. The patient is brought in, seated on a high chair with their back to the window to utilize natural light. Their head rests against the chest of an assistant standing behind them. This assistant has two jobs. One, hold the patient's head immovable. Two, keep them from running when the cold steel touches warm flesh. Dieffenbach, with the icy demeanor of a top-tier surgeon, begins the procedure. He knows that without anesthesia, speed is everything. The agony must be condensed into minutes, or the patient will die of shock. Step one, secure the target. Dieffenbach doesn't use his bare hands to hold the tongue. The tongue is too slippery and too strong. He uses an instrument called Museur forceps. Imagine a large pair of pliers, but the tips are armed with sharp, interlocking teeth. He inserts the clamp into the patient's mouth, biting hard into the tip of the tongue. The metal teeth pierce the mucous membrane, sinking deep into the muscle. And then he pulls. He yanks the tongue out of the oral cavity, stretching it to its absolute limit to expose the root deep within the throat. Just this action alone, the pain is enough to make an average person black out. But this is just the warm-up. Step two, the excision. Dieffenbach picks up a specialized surgical knife, a long, slender bisturi. He doesn't just make a small incision, he performs a triangular wedge excision. The blade slides deep into the root of the tongue, targeting the genioglossus and hyoglossus muscles. the groups responsible for swallowing and tongue movement. One slice to the left, one slice to the right. He carves out a prism-shaped chunk of meat right at the base. The goal is to completely sever the transverse continuity of the muscles. Remember, the patient is still awake. They feel the cold blade passing through the most sensitive part of their mouth. They hear the crunch as the knife shears through thick muscle fibers, and immediately an overpowering metallic taste floods their throat. Step 3, the red flood. The tongue is one of the most vascular organs in the human body. As soon as the wedge of flesh is removed, the lingual arteries are severed. The blood doesn't trickle, it erupts. In medical records from that era, this was described as profuse hemorrhage. The patient gags, coughing violently as warm fluid pours down into their trachea. The operating room fills with the copper scent of blood. Dieffenbach has to work with lightning speed inside that pool of red. Step 4, the stitch. To stop the bleeding and close the massive hole he just created, he uses thick silk threads. He pulls the two edges of the cut, now deformed, squeezes them together, and sutures them raw. Every needle prick through the twitching tongue muscle sends a jolt through the patient, who thrashes in the assistant's arms. When the final knot is tied, the patient is released, mouth full of blood, tongue swollen, carrying a permanent mutilation. You think the nightmare ends when the knife leaves the mouth? No, that was only the beginning of hell on earth. The days following the surgery were a battle for survival. The body's first reaction to this brutal invasion is acute glossitis. The tongue, already traumatized, begins to swell horrifically. Records recount that patients' tongues swelled so large they filled the entire oral cavity, often protruding past the lips, unable to be retracted. Swallowing became impossible. Eating was torture, but the most terrifying threat was suffocation. The inflamed tongue pressed back against the airway, forcing patients to fight for every single breath, even in their fitful sleep. And the result? Did they stop stuttering? Some initial reports, mostly from Dieffenbach himself, claimed brilliant success. A few patients, upon recovery, did speak more fluently. But how does modern medicine view this today? It was the placebo effect. Or simply, the physical shock was so massive, it temporarily altered their mechanism of speech. But that miracle didn't last. As the wounds fully healed, scar tissue hardened, robbing the tongue of its natural flexibility. The stutter returned, and this time it was accompanied by a crippled, rigid, and distorted tongue. They had traded maximum agony for zero gain. In fact, for a net loss. The scariest part of this story isn't the action of one doctor, but the enthusiastic response of the medical community. For a brief 6 months in 1841, tongue mutilation became a fashionable craze, a mania. Renowned surgeons in Paris like Musat or in London like Yearsley didn't want to be left behind. They raced to create their own variations. They cut horizontally, vertically, diagonally. They operated on adults and children alike. Hundreds of people were sliced open on the flimsy hope of a cure. But then as quickly as it arrived, the craze collapsed by the end of 1841. Why? Because the bodies started piling up. Patients died from uncontrollable blood loss. Patients died from sepsis or pyemia, a silent killer in the pre-antibiotic age. And patients died from suffocation, choked by their own swollen tongues. The medical journal, The Lancet, and critics began to speak out. They realized this radical cure was actually senseless destruction based on a biologically flawed analogy. Today, when we look back at Dieffenbach's procedure, it is viewed as one of the darkest errors in medical history. It reminds us that the line between a cutting-edge cure and a barbaric act of torture is sometimes just one wrong hypothesis away. Hundreds of tongues were cut, hundreds of voices were permanently ruined, all to prove one thing. Just because you can pick up a knife doesn't mean you are healing. Next time you find yourself struggling to articulate your thoughts, remember the year 1841. Be thankful you live in an age where the solution to stuttering is speech therapy and not the silence of the blade. I am, channel name, your name. Good night, if you can sleep.